Welcome to today's podcast show. What do we call it? This is Toni Weel from, as usual, sunny Florida again. It's always beautiful here. I have a kitty sitting in the window trying to look through the film that I have on there. He wants to look outside. He's my buddy here. He's always somewhere around where I am. We have with us today Katie Meert and Sara from Virtuous Unicorns and Gary Parents. And today's topic, I was like, let's do iridology again, because it is actually rather important. And to call it the art and science of iridology, I thought it is not a concrete science, because I found that people looking at my eyes, the professionals doing an analysis, sometimes came to different conclusions. What one could see, the other one could not, but it's it is a good insight into what is going on in your body before, and this is what I found so profound, that it actually is before you have the physical symptoms. It already shows the weaknesses. So when you're young, or whatever age you have, it's always good to know. It's like, okay, I need to be aware that, thyroid or um lymph stagnation, or the kidneys and whatever else is going on. There's a lot that can be seen. So we have a few eyes for you to go over. But first, I made the PowerPoint presentation in everything in the wrong order, of course. And now I have to see where I have it so I can share it with you guys. And let's make so that everyone can read it actually and see it. Um, I think I have to do a screen share. I need to find that one. Can you tell that I was very, very well prepared? We were just chatting amongst each other, and all of a sudden it was like, hey, it's already noon. Um, there should be an easy way to do a screen share. Sara, do you remember? I know we've done that before. Oh, share screen options.
Yep.
I,
And you're gonna have to pick which screen you want to share as well if you have
yeah,
multiple. Yeah.
okay. One participant can share at one time. Well, you only need to see mine. And the funny thing is, you're gonna see it opens up probably with my I made a new logo for my business, Mind and Body Health Center. So maybe it shows up there. I did a screen share and now I still don't see anything. So, well, darn it. Am I missing this here? Where is it? We've done this before. That would not be good.
I would say it should be like down along the bottom. I want to say it might be like three dots or something, like
Yeah, I am on the three dots,
and then just click share screen
and
or share.
it does not say share screen.
Hmm.
The recording.
I do not have my computer with me, so I apologize.
Oh my gosh, I should have looked at this first. It was always right there. Ah, right in front of me. Right in front of me, of course.
Did you find it?
Yeah.
Okay.
Okay, can
Oh,
you
it's
see
the
the
up
screen?
arrow. Yeah, there you go.
You can see it now?
Yep.
Okay, that would be my new logo. What do you think?
Cool.
Nice.
I like it.
Good. I like the blue. I like the leaves.
Mm-hmm.
I like the position. Yeah, that's going to be it. Okay, now I have to find, there we go. And I was like, well, let's start today with a disclaimer. Maybe that would be a good thing. So they leave um our podcast up, because the last one there was a mention about vaccines. You can barely mention that word, and it already triggers everything for the rest of the show. Okay, the disclaimer. Information isn't meant to treat, cure, or diagnose any disease. No medical claims are made. This is not medical advice. It is only what I would do based on my studies and experiences. If you choose to follow the information, you do so on your own and at your own risk. I cannot assume any responsibility for your actions. This is for reference purposes and is not intended to substitute for advice given by a physician, pharmacist, and any other licensed healthcare professional. You should not use this information for self-diagnosis or for treating a health problem or disease. Contact your healthcare provider immediately if you suspect that you have a medical problem, especially if you're pregnant, lactating, having high blood pressure, or taking pharmaceutical medications. Information and statements regarding dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or elevate disease or health condition. So there we go. That was that one. Got that one out of the way. So to go back is about our iridology podcast on November the 14th and 24. And this is a chart that was actually sold at the classes, Gary. I don't know if you can remember that, but I have this in a pretty large what is it, plasticized format. And I was like, this is pretty neat because it makes it so easy for, people who are just beginning out or just beginning with learning about iridology. So what do you think? Can you see it?
Oh yes, yep, I can see it. I use a different chart.
Yeah, I will show that one too. But I use this one when I send out an iridology analysis. I always have this one included so people can see it because it makes it easy.
Yeah, there are many charts, and
Oh yeah.
I've tried a bunch of different charts, and the one that you're going to put up that I use is the one that makes the most sense to me, but it might not make the most sense to somebody else. So go look at the different charts and see which one resonates with you, which one you can look at an eye and understand from the chart what's going on. Because some of them I don't know, I just can't figure them out. So this chart I've been using since the very beginning.
Yeah,
And
the other one, see, this one does not talk about the skin ring and so it is basic. This is the other one. We talked about that one yesterday. Um, this one is pretty clear too.
yeah, that's not the one that I use, but
Oh,
it's
okay.
and there's a left and right.
Yeah, there's a right.
Yes. Well, I just want people to know that there's a left eye chart and a right eye chart.
Yeah, you always have to look for both. And if you are looking for chart, they even sell them on Amazon. Always look for a Jensen chart. That is the one Dr. Morse uses, and that is the one that we use. And it is what makes the most sense with what we have learned.
Mm-hmm.
Now we go over the whys. The eyes are a map of the different system of your body, such as your brain and nervous system, endocrine system, bone and connective tissue, digestive system, and your lymphatic system. So we're looking for areas of lymphatic congestion and inherited genetic weakness so we can support, clean up, and strengthen these organs, tissues, and systems of the body. The 95% of disease comes from tissue weakness and the reflex conditions that can result. For instance, when the adrenal glands are weak, low pressure, low blood pressure, ovarian cysts, fibroids, fibromyalgia, female cancers, diabetes, MS, and the likes can result. Iridology is the only science at this time that can see soft tissue weaknesses and toxicity. Iridology isn't a science about disease or the diagnostics of symptoms. Iridology approach is a holistic and takes in the interrelationship of all the tissues in the body. By cleansing and alkalizing the body with raw fruits, vegetable juices, regenerative foods, and herbs, you can regenerate yourself. So there was the disclaimer. And this is, part of the analysis, and you can see on the image, if you look at one, that is the acute, the beginning stages of toxicity and weaknesses. But let's talk about what does it mean, constitution? It shows your body's overall strengths. Your parents mostly determined this as genetic plays a major role in one's physiological and anatomical process. A poor constitution general means a poor immune system, prone to disease and toxic settlements throughout. A strong constitution, on the other hand, shows longevity, endurance, and cellular strength. And it usually also means that you just heal a little bit faster. So if you go clockwise, then you see from 1, 2, 3, 4, and 5 is where the lacunas get bigger and darker. And so the 5 stages are acute, subacute, chronic, degenerative, and genetic. Now, if anyone wants this presentation or wants actually have a long intro into iridology, you just have to send me an email and I send you the PDF. And the email, as usual, is healthywithfruits@gmail.com. Now, this is what Dr. Morse says about the iridology. Your cellular constitution is shown in the iris of the eye and reflects your body's overall strength or weakness genetically. Your parents mostly determine your body's genetic weaknesses. The weaker the constitution, the more problems one will experience in life with their body. Your body regeneration process is slower and one can have many healing crises. A strong constitution, on the other hand, shows endurance, cellular strength, and longevity. A strong genes individual can conquer almost anything. Rebuild your genetic weakness throughout regenerative detoxification. Your lymphatic system is always compromised in your genetically weakened areas, which is what breaks down the cells in the first place. And it's one of the reasons that when we work with a client and we have a health questionnaire, we do ask about the health of the parents and even the grandparents, because it does play a role in how your health is and in the strength or your body's genetic weaknesses. And we always surprised, how can a baby be born with issues? I was considered a very, very healthy baby, was like, almost 9 pounds. I think in Dutch it was 8.5 pounds. And yet I was born with a whole bunch of problems, which were like, oh yeah, that's just normal. That's what a baby has. And now we learn, no, it's not normal. So this is an image that actually Gary put on his in his group, because he has an iridology group. He's just not that active in it anymore. You should, Gary.
I know.
Oh, yeah. And this was about how can you see a prolapsed transverse colon. And this is where I'll give it over to you, and you can talk about this.
To me?
Yeah, you.
Okay. So
It's your image.
yeah, so a weak transverse colon is a parathyroid issue. And to help that parathyroid, we need some good live hydration, fruits, berries, melons, and I always include vegetables in that, because some people, I realize that the fruits, berries, and melons have a much higher energetic rebuilding ability, even over vegetables. But vegetables will still help. They'll still help us grow, to regenerate tissue that is literally dying of thirst, dying of malnutrition, and lack of oxygen. And all those will bring those in the energy that
Oops,
it's, oh, what happened?
I'm
Okay.
back.
Okay. And I can't see that very well, but anyway. So when you're working with the parathyroid, and this is something that I do when I do read eyes, I don't spend a lot of time saying, well, this is wrong and that's wrong. Okay, we have an issue in this area and it involves the parathyroid. So we need some good hydration, nutrition, and oxygen into that area. And now we need movement and we need rest to detoxify that through the 13 channels of elimination the body has to use every day to maintain its health. So almost anything that I see in the body, I use the eyes as a general way to help people understand what areas are in the most need. So I might only do 3 or 4 things. I mean, I could dive so deep into an eye that you'd feel like, you know, like you just went in the hospital and they gave you this big long story that just zapped all the energy out of you. And that's the part of this is we want to help people regenerate. And we can cause a lot of depression by going into every little tiny detail and list things a mile long that are wrong in the body. You can't work with the liver without affecting everything else. You can't work with the kidneys without affecting everything else in the body. So the body, even though you're having issues in the body, and it might be a wide range of things, if we can hit the important things like liver, kidneys, digestive system, if we can hit those, the body will rebuild all the rest of it all on its own. So, and there are many herbs that we could use for that. So, and we don't need like a ton of herbs. You know, I think I use maybe 7. But if you're really interested in herbs to help parathyroid, Dr. Morse has great herbs, and Toni can set you up with those. I find getting too detailed, it's not only tough on the person that I'm doing the reading for, but it's tough on me because I have to explain all this stuff. When actually, if I just went with a general thing, all the things that are wrong will correct themselves.
Yeah, that's the whole idea. You mentioned with the image that, and I will read this. The prolapse transfer colon symptoms means, and that was from the image on the previous page, weak tissue and support the parathyroid. It can cause bowel obstruction, abdominal pain, constipation, absorption issues, reduce blood flow through the prolapse segment, can result in, and I don't know how to pronounce that word, ischemia and chronic pain. This issue can be life-threatening over time if not appropriately addressed. Well, anything that we ignore can be life-threatening. That's what we mention all the time is if there is pain, it is a signal something is not should be. So don't grab for these painkillers because it just suppresses. Yeah, it may take care of the pain, but it doesn't take care of the problem. So the best way is to help your body rebuild weak tissue, and that is not just the prolapse transfer colon. It's like with everything. It is support the parathyroid, and I from what I've seen, Gary, it's like everyone I talk to has weak parathyroid. So that is always the thing to go to. Kegel exercises to strengthen pelvic muscles and support the weakened tissue in that area. Constipation, eat fresh, high fiber food and drink plenty of life-giving fluids. And I'm always like, drink water too. If you want to add a lemon, please go for it. Avoid bearing down to move your bowels. Avoid heavy lifting. Control coughing. Lose weight if you are overweight. Start doing slow movements like Qigong, Tai Chi, light stretching, walking or strolling, grounding to the earth, and do deep breathing exercises. We can all help our bodies heal themselves once we understand how something no one ever taught us. It seems it's all cut, burn, and medicate, and that is not healing, really. So that was actually something that you wrote. What was it? About 8 years ago, 6 or 8 years
Yeah,
ago?
yeah, I
Six.
think so. Yeah.
And this was another one, and that is when we were looking at that other image and talking about the Constitution. Here, can you see what we call lacunas, and these are then areas that are very weak that you really have to look at. But it's like you can look at pretty much the colors, the drug deposits, the sulfur, but this was about these are lacunas. They are football-shaped areas in the iris. The deeper and darker they are, the more the acids have damaged the tissues in that area. So then when you see this in your eyes, you may have a good look at yourself and try to really, really start taking care of things, start detoxing, realize your body needs healing. And no, you're not, if you see that, it's not, oh my gosh, I'm going to die in a few months, because what Gary just mentioned, the more detailed you make it, I had one, and I won't say who did that, but I had one iridology reading, and I had several, because when I just started out, I wanted to see how are the pros doing it. And then, eventually you just find your own way. But I got one back I was looking at it and I was like, I'm going to die in a few months. This is just, I'm going to die. And I'm pretty down to earth, so I don't take it so seriously. So I put it aside, but it was kind of gnawing at me. It did make me feel uncomfortable, and we never want to go that direction, towards people, because like what Gary said, your kidneys need to filter, and you have certain weaknesses, so do the work. So we have eyes from a lady called Katie, and that shows a pretty strong genetics. Gary, can you actually see details here, or do I have to see if I can make it larger?
No, I just did it myself right here on my phone.
Okay.
So that was pretty good. Let's see. Okay, I'm looking at the left eye right now. And there is a slight prolapse of the transverse colon. There is some bulging in let's see, this left eye, in the large intestine. So there's weak tissue in that large intestine. And down at the, more in the pelvic groin area, there is some chronic going on there. I don't know how big I can actually make this and get it to. Okay. So there's a little bit of a skin ring around the outside, which is I don't know if people can see this, but in the iris of the eye, there is a dark ring around the outside. Okay. There's a little bit, this is the left eye now, little bit of the lymph nodes are congested. There's quite a bit of congestion. And this is all, what I'm looking at right now is all what you would call stage 1. There are 4 stages of lymphatic congestion. So we're looking at a blue eye here. And stage 1 of lymphatic congestion in my world is you're not really going out and looking for medications from the drugstore. I want to make the emphasizing drug. It says drugs right on the side of it. It's not plant medicine. So that area down by the pelvic, ovary and groin area, that's a little concerning. It is kind of in the bottom of the large intestine. So I can't enlarge it enough to see if there's a malabsorption issue. I'm thinking there's a malabsorption issue there. It's not heavy, but I'm pretty sure that that's what it is. I can't enlarge it enough. And there's a lot of mucus in that intestinal tract. And your intestines do have a left side and a right side. So what I would focus on in this particular case, parathyroid, cleaning out the intestinal tract, the digestive system, getting the skin, like maybe some, and I know this goes sideways with a lot of people, but infrared or do a steam room to get sweating. Looks like there's a lot of congestion in the skin area. And obviously the breathing and the qigong will help move all that stuff. They need a lot of massage in the organs and glands, which would be from your solar plexus to just above your groin. That whole area right there. That when you're doing deep belly breaths, you're massaging all that area and you're moving all that material, and you're getting blood in there and you're opening up the lymphatic pathways that will help get that out of there. And opening the 6 lymphatic gates is really important in this particular case, in all cases, really. And when we look at the sclera, all those red lines go into different areas. They're pointing at different areas in the iris. So we have one sitting here, it'd be my right side, that goes right up into like upper abdomen, the spleen area. We have one that goes right into groin, kidney, adrenal area. I have one over here that lower back and pelvic region. And unless you have a chart, you're really not gonna. But those are areas that need to be worked on. Thyroid, parathyroid. There's a red line pointed right at it. So when I read an eye, that's what I do, and then I take a general thing and I give my opinion of what's going on in a way that, okay, so we need to support the parathyroid. It wouldn't hurt to support the thyroid since it's right there. And when we're doing our humming or our sounds, our healing sounds, you're vibrating the throat, which is shaking those cells around that area. And that is helping to break up that mucus and to open up those pathways and get things going. But you're going to need some good hydration. And you can get that from sun-ripened fruit. You can get it from berries. You can get it from melons. It might not be as powerful, but you can get it from vegetables. And the reason I keep mentioning vegetables, a lot of times the fruits, berries, and melons are so powerful in the body that it causes too deep of a healing crisis, which is like a cold and flu-like symptom. So if we back down to vegetables and they're not as powerful, it's an easier transition. And then after a while, we can start adding in some fruit, and then more fruits and more berries and more melons. And for people that don't want to do that, there's the Master Cleanse, there's smoothies, there is a bunch of things that we can do there. But we need hydration. Most of what I see in this eye is a lack of hydration. So, and to be able to absorb that. So if that is a malabsorption ring, I'm still on the left eye here. Let's go check out the right eye. Yeah, we have a lot of the same thing going on here. There's a lot of parathyroid issues here, a lot of bulging in the intestinal tract. Transverse colon is weak. Uh, the skin ring is actually a little heavier here. The red lines going in point right to parathyroid, thyroid. I don't see as much chronic in this particular one. There's a spot in the left eye that is really that needs to be taken care of. So again, you're going to be end up with the same thing on both sides. Now it can be more severe on one side than on the other side. There's a little bit of a hazy, almost like blue up in the head area. That's circulation. So we need to open up that circulatory thing, but there's no real radii solaris. There's no lacunas. So this can be cleaned up pretty easy. But getting that parathyroid and the thyroid and getting that mucus out from around the tissues, especially up in the head area, the left side has more congestion than the right side. So that would be my recommendation for this is there's probably not a lot going on there. And either they had a real heavy night out drinking or these red lines that they're there all the time. Okay. These are acids going into the eyes, and the eyes are there's a lot of lymph in there, and when it's not doing its job and it gets acidic and it's not able to pull that acid out, then it's going to start things. You'll be on the glaucoma watch list, or you'll end up with glaucoma, and those are all acids. So upper circ, brain and nerve. You can use a lot of eye washes, putting your face in the cold to help reduce the inflammation. There are a number of things you can do there that will help reduce all this. So not too bad. You do have some lymph nodes there that need a little help, more on the right side than the left, but not a lot, and they're not super congested. So they should clean out pretty easy. Left eye. Let's see something I want to check there. So there's a little bit going on in the and there's more mucus, but it can be cleaned out, and that's in the heart area. So
Thank you, Gary. Katie, do you have any questions? Katie fell off a chair.
Oh yeah. No,
So-
no, no. Yeah. I couldn't get my screen to pull up where I can unmute myself. Well, I had a hysterectomy. So in my left eye where you see that
Yep. That spot.
yeah, that I think it's because of my hysterectomy, and then I have a sling, is it in my bladder? Is that what it's called? Yeah, and then I'm like, I should get that removed. But I don't have medical insurance right now, and I don't really want to go through another surgery. So,
Right.
so I'm just like, and then I've heard that when you truly get yourself cleaned out, that my body will naturally push that out. So I'm working on it.
Yeah, that's all we can do, right?
Yeah, yeah. No, Gary, thank you so much. I can't wait to watch this again because I was trying to write all these notes down, and then obviously I'll speak with Toni about what to do, but what more to do than what I am already doing. So thank you so much for taking the time to look at this.
Oh yeah.
This is very, very good. And thank
Yes.
you, Toni and Sara, for hosting the show.
Yes, Katie, I also have charts of the sclera, and I was going to add them, and then I forgot.
Yeah,
Because that make it very clear what exactly those red lines in the eyeball are.
yeah.
So I will add that to the presentation and then send it to you.
Perfect. Thank you so much.
All right, we go on to the next one, which is Matt.
Well, I think Matt has a blue eye.
I hope too.
And a lot of chronic stuff going on here. Let's see. Okay. So we'll start with the left eye. A lot of redness in the sclera. So wherever there's a dark line and is pointing at the iris, if you go into the iris, then thyroid, parathyroid, I mean, it pretty much covers the whole iris, the red lines coming in, and the darker they are and the wider they are, the more issues they're having in that specific area. Now there are nerve rings here too. So nerve rings are stress sign in the body, in the tissues of the body. So relaxation would be a good thing here. But there's a lot of chronic stuff going on here. There is a skin ring here too. So getting in a sauna or a steam room or something like that, where you're going to promote sweating. You want to be able to do river sweating. And when you get in there, say it's 140 degrees or whatever you like for a temperature, okay, within 5 to 10 minutes, you should have water just streaming down your body. If you're not, then that's part of the problem. There's acids hanging in the skin underneath it. So the lymphatic pathways are not open for you to sweat. So when you go in a sauna, always take a glass container of some type of live liquid that you can sip while you're in there, because as the water's running out of your body, you need to be replacing it. And that's a good thing, because it's clean going in and what's coming out is dirty. So you're doing that little conveyor belt thing. Same thing is going on in the earth, right? The water is evaporated, goes up to the sky and falls back down. And we have the same exact amount of water that we did when the dinosaurs were here, and probably before them, because water can't leave our atmosphere. So whenever they say there's a shortage of water, you want to be skeptical. But need hydration in this body big time. And so pretty much chronic throughout this left side of the body, and that goes right from the head right around to the whole body is in a chronic state of lymphatic congestion. There are some dark spots here, and that could be like a deposit of some kind, like chemical deposit, like medications and things like that can stick in different areas. And it looks like one that I'm looking at is in the groin area, specifically the testes, upper neck, thyroid, parathyroid, or throat, and one up in like mind agility. So pituitary and pineal gland could use a little help. Basically, what I would suggest with this, and we'll look at the right eye here. So the right eye doesn't have as many deposits in it. It does have the nerve rings, chronic digestion, and it's running. There's some radiocularis up here, and they're like a river for and this one's running right out of the intestine. It goes right up in the head, up in a sinus, energy level. So these are like rivers for the acids to flow back and forth through. Okay. And so this body needs a lot of hydration, a lot of sweating, some good ripe fruits, berries, melons, some vegetables, this body, I would say, would probably be better off to start out with a green smoothie and then work their way into the fruit. And you shouldn't mix your fruit and your vegetables together, because the combination, the digestion process is at a different rate, so it can cause a few issues there. Now, there are people that eat fruit and vegetables together and don't seem to have a problem. So it's up to you and your body to find out which one of those is the most important. But yeah, rest. There's a lot of stress in this body. Breathing, getting that emotion out of your body. But yeah, these eyes don't look like they're blue, but I believe they are blue. And you might go back and find pictures when you were young, maybe they were blue then. My eyes were black. Unless I was in direct sunlight, you couldn't see my pupil at all. And I have brown eyes. So, nobody gets away with a, pass go and collect $200 when it comes to the lymphatic system. The lymph has 4 different stages. One is the white you see, that's the lymphatic congestion. That's not bad at all. 2, the lymphatic stage 2 is yellow. So that when you have, and it's translucent. So when you have yellow gathering in the eye and the light shines through it, your eyes look green. So the more green they look, the more into stage 2, the deeper into stage 2 you are. Stage 3 is brown. So that is chronic. And we need to get that's super dehydrated, lack of minerals, lack of movement, and you may move. I'm not saying that. I'm talking about breath. I'm talking about getting the internal body and being in tune with it so that it can flush itself. Right now, what's happening is the filters are dirty. Just like in your car, and the filters get dirty, you can't function properly. Well, we need to get that good hydration, that good live foods and liquids into your body, and then start I think I mentioned in a video the other day. So you can eat fruits, you can eat berries, you can eat melons, you can eat vegetables, you can clean your diet, you can do live liquids. It's kind of like making a cake. If you take all the ingredients and throw it in the bowl and put it in the oven, it's not really going to come out like a cake because nobody stirred it up. Well, it's the same thing. We're eating all these melons and fruits and berries and all these different things, right? But unless we're doing Qigong and breath work, we're not mixing it up. And it's in the mixing that creates the energy. And it distributes it through the body as it's massaging it. So it's just a natural way to help your body regenerate itself. Because there is a lot going on here. And like I said, the left side is hurting more than the right side. At least from what I see in this. The nerve rings are a little deeper in the left side. There's a lot going on in the right there too. But it's all regenerative. It can all be fixed. And it's not going to be pills that fix it. It's going to be proper hydration, nutrition, and oxygen, movement, rest. Grounding to the earth is going to be super important. And having a great story. I may not feel great today, but every day I get stronger. Every day my mind gets a little clearer. My strength increases a little more every day. My breath goes deeper. There's more oxygen in my blood to help my cells. These are words of power. Your body has to do what you tell it. And there's the power of that is you will help your body regenerate itself back to health. It's the lack of that conversation and the lack of proper hydration, nutrition, and oxygen movement, rest that created all this that we're looking at in the eye. So when I look at an eye, that's what I'm looking for, is what are the best ways that I can help that person get their health back. Now, I would also say, and this could just be light, the way the picture was taken, the pupil in the left eye is just a little bit bigger than in the right eye. And what that means is an adrenal weakness on that side. And that left side is suffering more than the right side, at least from what I see right here. So I think that's where I'd end that right there, is need a lot of good hydration, nutrition, oxygen, qigong, yoga, light stretching, and definitely breath work. You got to get that diaphragm going up and down and get that moving, going for walks. The other two lymphatic pumps are manual, and they're the balls of your feet. So as you're walking, you're moving the lymph. Make sure you get rest at night, because when you lay down, or even, well, not so much during the day, because the sun heats the earth. Well, as we're moving, we're heating our body up. You can put yourself in a full sweat if you do breath work properly in a half an hour, because it increases your internal heat. It increases your metabolism. The moon, when it comes out, is when the earth rests. Well, it's when we rest too. So we lay down, and from our feet to gate 1, which is right above your collarbone on each side of your body, that's where all that toxin has to run to, and has to go through 5 gates to get there. And if any of those gates are closed, then it's going to have a hard time getting there. And the more it backs up, the more dis-ease you're going to have in your body. So I think I'll leave it right there. You got another one?
Yes, I got more. I want to ask Sarah, can you check if there are any questions in the chat, because right now I can't see them. If
Yep,
I
let
want
me go ahead and check.
the screen open. This one is from Kathleen. And I think this is all the left side and this is the right side. It's on 2 different dates, 22 and 24, right, or years.
So, yeah.
The bottom ones are the most recent.
Okay. There's a lot of light difference here, but we'll see. There's a malabsorption issue here. I wonder if they had cataract surgery. Could be the light, but the top one in 22,
yeah,
looks like a cataract in the middle there, and on the bottom.
I think it is the light, because there is kind of a blue haze over all of the picture, all of the image, and I don't really see it in the bottom one.
That's what I mean. I don't know if there was surgery there or not, but
okay.
But a lot.
I think Kathleen should be in the chat. So Kathleen, if you're there, can you let us know? And I know, Sarah, you gotta leave in about 10 minutes. So
yep, I'm looking in the chat right now. Kathleen has not replied from that question. Do you want to wait to see if she replies, or do you want Gary to continue? Because there are a few questions in here. Oh, there's Kathleen. She says, I moved in 21 and haven't been able to get a good picture sent. No cataract surgery.
okay.
So it's a lot. So we can rule that out. And I always say that whenever I do a reading for somebody, I say, I can't tell if you have cataract or if it's a light. And so the whole thing about what we're doing here is we're looking for things, but light plays a huge role in these pictures. Now in the 2024 picture, is a much better picture, but you see that purple around the outside of the iris? That's usually a circulation issue. And it might be in that top one, but I can't really tell because this is a much better picture on the bottom. There's a lot of chronic lymph throughout the whole body here. There's nerve rings. Like I said, I think there's a slight malabsorption issue. I can't really. A little bit of a that's left eye. Let's see. There's a little bit of a in the large intestine is a little bit. It's inflamed. It looks like a little bit on the large intestine in the left eye. Because it's out further from the pupil than the other side, and the other side looks like that would be the small intestine, and that looks normal. So when we see it's not even all the way around, if there's a bulge in one side, that means that that particular one is having some difficulty with tissue, weak tissue. So that'd be parathyroid again. A lot of radii solaris up in the head, goes up into balance, the motor function. There's a lot of radii solaris, and it's coming right out of the stomach. So in many areas, kidneys, adrenals, spleen. So just to pick a few things like that. But again, it's lack of hydration. It's lack of proper nutrients. And if there's a malabsorption issue, then it makes it more difficult for the body to absorb what it needs. And another way to do that is through your breath work and through your qigong or your yoga or your light stretching, or and to be consistent at it. So let's look at the other eye here. Yeah, there's a lot deeper. This eye hasn't improved. This side, it looks like it has improved a little bit. But that definitely looks like a malabsorption issue. And the radii solaris up in the head area goes right into the digestive system, goes right into the pupil, a couple of them. So that's more like the brain stem, balance, dizziness, reality. I would say the pituitary and the pineal gland need some help. Liver, gallbladder, kidney, adrenals, kidney more than adrenal, but they're on top of each other. So the adrenals on top of the kidney. So skin ring, again, sweating. It sounds like it's an issue. There's two ways for cellular waste to get out of the body in liquid form, and that is to urinate or to sweat. And the sweat is actually urine. That's why you have to keep washing it off. And this is the thing that gets me. We spend billions of dollars every year washing all the stuff off the outside of our body, but it's all coming from the inside of our body. And we don't spend any time flushing the internal body. And when we do, once we start doing that, everything starts to work properly, and we don't have to, it isn't that we don't have to shower as much, but we're not washing off as much stuff, because when the body eliminates stuff, it always pushes it out to the outside, and it shows up on your skin. It shows up by not sweating, or it shows up when people that are heavy sweaters, right? Not wear heavy sweaters, but are heavy sweaters. that particular thing is because your kidneys aren't functioning properly, and it's pushing it out the other way. It's the duality of it. So there's a lot of chronic stuff going on here: digestion, intestines, all the way around the whole body there. And there are nerve rings, and I'm pretty sure this is a blue eye also, because there's only two eye colors, blue and brown.
Say, Gary, can I ask you a quick question?
Yeah, yeah.
So you recommended asana for Kathleen as well, and you really emphasize the sweating part. Now, do you recommend like a dry sauna or like a wet sauna, or does it matter?
Uh, well, I would say whatever resonates with you or makes you feel the best. I would try both and see which one you like. Because if it doesn't harmonize or resonate with you as an individual, even though you may not think you are, you will resist it.
Yeah, I just know that most like gym membership facilities that offer the
Right.
sauna experience have moved to a dry sauna. So that's why I asked, because
Yes.
mine has a dry sauna. And then if you would recommend, like the wet sauna, I don't even really know what the real name is called, then I'd be like, oh shoot, I don't know where I'm gonna find that. So
Right.
thanks so much for answering that.
Yeah, and the other thing is you could also do an infrared. Now, there are people who have problems with infrared. There are people who have some problems with dry saunas and wet saunas and all this stuff. It's whatever resonates with you, whatever makes you feel good is what I would recommend in that particular thing. I've done them. I've done them all, and I love them all. So, and I had a hard time sweating when I first started going to them. Now, in 5 to 10 minutes, I'm in a river sweat. Maybe not full river sweat, but I have lines of water running down my body. And I always share, well, this is back in Maine, but when I went to a sauna, you could have another person. It was like, I don't know, $25 for me or something. And for $10, you could have somebody else go. So I would always pay the extra 10 and bring somebody else with me so they could experience it too.
Okay,
And
that's a great idea. Thank you.
yeah, you're welcome.
It's actually Dr. Morse who says that the infrared saunas, they are like a microwave, burn you from the inside out. So I had an infrared sauna and I got rid of it. And I bought a brand new one, and it was, I used it twice. And then I don't like saunas at all, never did. I kept trying it, still don't like still don't like it. And then I had a steam sauna. I think that is what you mean with a wet sauna, Katie.
Yeah.
And with the steam sauna, I wondered if the water that was coming off my body was from the steam that got into that little thing that I was sitting in, or at least I could keep my head out, because that was usually the problem. I couldn't handle the heat on my head.
Right.
And
I was going to ask you why. So that's why.
yeah,
Yeah,
and
that's why you really need to, like, I did Lakota Sweat Lodge. I did 7 days in a row, and those are intense. But again, it's wet. You have hot rocks, and they put water on it, and they put herbs on it, and it kind of filters the air, so it's cleaning your lungs as well as making you sweat. And sweat you did, trust me. That was pretty intense.
right. Yeah, but I think that Katie mentioned once she did it every day, and I wonder if that would be a good thing to do it that often, because it is not a natural thing to make the body do something that intense for a prolonged time.
Yeah, it once a week, maybe once every 2 weeks, maybe. But you're right. It does stress the body out. And when you're first starting, it's good to maybe do once a month, just to give your body a chance to adapt to it. But yeah, we can overdo anything for sure.
Yeah.
Be careful of that.
Thanks, you guys. I did not realize that. I appreciate that.
Mhm.
Okay, we got one more, Gary. I already.
I have a quick question. So instead of doing like the saunas and stuff like that, what about just traditional sweating, like walking, working, and just kind of being outside and doing stuff? Because that's the majority of the sweating that I do.
Yeah, that's perfectly fine as long as you're sweating.
Yes.
Because there are people that could do that and they could be in a sauna. They're still not going to sweat because those channels are so congested, so plugged. So, yeah, going for a hike in the mountains or anything that's going to make you sweat.
Yeah, like my whole body gets sweaty. Not it does more often than not, but like even my whole back, even my legs,
Yeah,
like
yeah.
it comes out everywhere. So
Well, that's good. That's
yeah.
good.
And people are really embarrassed about that. And like I get it, like if you're at a gym and you're sweating, you're leaving your stuff all sweaty and stuff like that. But I mean, you just clean up after yourself and maybe,
Hmm.
wear layers or something, but be very, very careful on the layers that you're wearing too, because a lot of that stuff has forever chemicals in it.
Oh, yeah.
So wear like as much natural clothing as you can. Also, a side note, even if you're buying like linens and 100% organic cottons, that kind of stuff, keep in mind like what you're washing your clothes in, because the moment you wash them in something chemically, then to me, I think you've ruined your clothes. But anyway, so yeah, like I sweat everywhere, and we have to get used to that and be okay with that. Even when I play volleyball and stuff like that, because I don't wear deodorant either, and I've been told by multiple people that I do not smell, and my brother will straight up tell me if I smell, and he tells me that I don't. So
Yeah.
you just got to get used to it and know that sweating is okay and it's a part of it. I know people that get Botox in their armpits to stop the sweating. And
Yes.
oh my gosh, that about made me cry. I was like, oh my gosh, because at that moment, like I can flash to the future and I can see health problems they're going to have in the future. And it just made me so sad. And it's because, sweating is, it's not feminine, it's not hygienic, it's not,
Yeah.
stuff. So
Oh, perfect.
what was that? Oh, okay. I thought somebody else was saying something, but yeah.
That's
So
something.
that was gonna be my other thing too. But I've never been in a sauna, so I've never really known what to do. I've also had a concern about what kind of water they use if it's a wet sauna. Like, are we getting poisoned by the chlorine, if they're using that, or so I've been very skeptical about them. But that was my input.
Now, here's another scary thing about the armpits. I did a video on this a few years ago. This is it's not approved by the FDA, but it's already for sale. It is a microwave that you put in your armpit, and it kills your lymph nodes,
Oh my gosh.
so that you can't.
Oh my gosh.
So
That
that you
like
can.
almost makes me panic. Like, because people are gonna do this. Oh.
Okay. No, don't be working on your kidneys.
Yeah. Oh my
Don't
gosh.
don't help those. We'll just nuke those those lymph nodes.
Oh God, that made me
That'll,
feel flush all over and panic a little. Like, oh my gosh.
yeah,
Oh,
yeah.
please, if anyone listens to this, just trust your body. God knew exactly what he was doing. So just trust the process, eat your fruits.
Yeah.
Um
And
yeah.
in Japan, they're making edible burger wrappers.
Oh,
So when your burger comes out, you eat wrapper and all.
we're getting that lazy, huh?
Yeah, well, and their big boast is there's no trash because you're eating it.
Oh, okay.
Well, you eat the trash anyway.
Yeah.
Yeah, that's true.
So they're talking about bringing it here to America. I haven't seen it. So
Of course they'll do that. Oh my gosh. And then to tie in what you said a couple episodes ago about the Ozempic,
yeah,
having all the side effects and everything, I
yeah,
got the paper, this is our wonderful election we just had. I wanted to get a firm copy of it. I opened it up and on, I don't know, like 3 or 4 pages in, a whole entire page was taken out on all the stuff that you had talked about what Ozempic has been doing to people.
Yeah.
So
It's funny how that happens.
yes, it is.
Not funny, haha, but
Yeah, how it all comes out.
yeah.
Well,
So we're finding
I'm
out
loving
a bunch of
these.
things.
I'm loving these readings. So please go ahead. And
Okay.
then when it's time for me to hop off, I'm just going to disappear. But this is wonderful.
All right. So I think I know whose eyes these are. So we have a lot of subacute, which is stage 1. You know, there's 4 stages of cancer, and there's 4 stages of lymphatic congestion. So it's just bringing that up now they have 5 stages of cancer, because they just created another one, because you can't have enough names for things, and every time they divide it up, it makes them seem more like they're the expert, and we're nothing. I just posted a thing today. There's 262 different names for sugar. So what that means is they can put all these names that people don't know that it's actually sugar through the label, the ingredient label, and you won't know that it's sugar. So sugar would actually be the number 1 thing in there, but because the way they got it divided up, it's not the number 1 thing in there. And because we don't know how to read the chart. So I just thought I'd throw that out there, because a lot of what's going on in these eyes that we're looking at is sugar, not fruits, berry, melon sugar or vegetable sugar, but man-made sugars. And a lot of the things that are going on here are table salt, because they're congesting the body. They have aluminum. They put aluminum in the salt. And where does aluminum go? To the brain. And what does it cause? Brain fog.
Gary, I have to interject. This
Yep.
person has not used any table salt for, well, more than 2/3 of her life, and has not used any regular salt, sugar at all since early 20s.
Yeah, but I wasn't speaking directly about you.
Well, it's my eyes.
I know it is. I know it's right. Now I notice.
I just had to say that.
Okay. So down in the pelvic, lower abdomen, reproductive, and upper abdomen area, you've got a little bit of chronic starting to creep in there, and you have a lymphatic rosary there. So I don't know how many people can see this, but there are dots around the outside, little white dots, like you took a white felt tip pen and just put a bunch of dots around the outside. So your lymph nodes are congested, especially in the lung, rib, chest area. That's probably where it's the heaviest. Can't quite see the bottom, but we have a couple of spots where the parathyroid is having an issue. Up in the head area, there's a lot of mucus up in the head area, a lot of lymphatic congestion. A small intestine has a little bit of a bulge in it, and so does the right. So weak tissue. So parathyroid definitely needs support. Skin ring, so the skin needs support. So there's it's not a lacuna, but it's close, which just means weak tissue, but that's in the lung on the left side, and over in the more in the throat, esophagus area on the other side of the iris. And that's really all you need to know.
Yeah, now these are pictures, they are probably 2 years old. These were taken in Dr. Morse's office. They are 4 years old.
Okay. I think I lost your pictures, though. Maybe. I don't know.
Yeah,
No.
I just scroll down to the ones that are older to see the difference.
Yeah. Okay. No, I got it right here. I just didn't. There we go. These look like different pictures, though.
Yeah, they come out because, you know, he uses a regular camera with a macro lens.
Yeah.
And first time I saw this, and this is 5 years ago, and I was like, "Are you sure these are my eyes? Because when I look in the mirror, I don't see this." I was like,
Oh, yeah. Well, that's the thing. You have to be able to blow them up. And there's definitely a malabsorption thing going on.
yeah,
More on the right side than the left. The pupil, now that could be the light, but the pupil is larger on the right than it is the left. And that can be an adrenal issue. The lymphatic rosary on the right eye is a lot more defined than on the left eye. But again, it's in the lung, chest cavity area and the necks, like your throat, thyroid, parathyroid.
yeah, there's a lifelong thyroid issue.
Yeah. So that's what I would say there. There's a lot of weak tissue up in the neck, lung area on the right side, more so than in the left eye. On the left eye, it's more over in the bronchial lung area and over in the throat, esophagus, windpipe area. So when we have a malabsorption issue, to get that back, we need movement, we need rest, we need hydration, proper hydration, and sip the liquids and let it sit. It's like I did a live video one time and I took this plant pot because I thought it was going to work perfect. It was so light. I mean, the plant could knock the pot over. It was so light. There was no water in it at all. And usually when that happens, you pour water into the thing and it runs right down through and out the bottom. Well, that's what happens to us when we have a malabsorption issue and we drink liquids, they run right through us. You hear people talk about that all the time. Well, I can't drink a lot of liquids because I have to run to the bathroom every 5 minutes. That's a malabsorption issue. Also, up by your transverse colon, up by your solar plexus, if you drink something and you move and you hear it sloshing around, it's not absorbing. So there's a malabsorption issue there. So when you sip, let's say you pour that water in that plant and it runs right through. Well, if you put a little bit in and pick a different spot, put a little bit in, a little bit in, a little bit in, eventually it will fill itself up. The other thing you can do to help with that is take it and submerge it in water, but you usually have to hold it because it'll keep, it'll tip over. So you want it to soak up through the bottom. Well, that's like taking a bath. You're absorbing through your skin. So if you go for a swim in the lake or the ocean or whatever, you're going to be absorbing water. Not so much in the ocean because of the salt. The water in the ocean, because of the salt, could have a dehydrating effect on you, whereas pulling the water out of you. So I would recommend a lake, good clean water. And I know this is almost impossible to do because it takes so long to make 6 pH water. But if you could bathe in 6 pH water, you'd be amazed at how your skin would regenerate itself. Because the pH of the skin is about 5.5 to 6. And whenever you have a rash come out, a redness or whatever, you put 6 pH water on that and you can watch it disappear. The other thing you can do, and I know they do this in hospitals every once in a while, when a baby has had the diaper on too long and you have diaper rash, you can take oxygen and spray oxygen over it, and you can watch that diaper rash disappear. You could do the same thing on your skin. Uh, like shingles. I had a friend call me from Vegas, and she was having a problem with shingles. And I said, well, black walnut hull, and put it in, if you can't get the oil, put it in uh, coconut oil or something like that, and just rub it on there. And she goes, I have a black walnut tree in my yard. So they don't get some of the black walnuts off the ground, black walnut hull, and scraped it and put it in that and put it on. And within a half an hour, the shingles were gone.
Wow. Because I have talked to quite a few people with shingles,
Yeah.
and actually we had Donna on a while ago, and she has shingles. So we didn't get to talk about black walnut then. I have a big black walnut tree right next to my house,
Mm-hmm.
and you hear them pop on my roof, and you hear the cars, and they think they blow out a tire because they drove over one. So,
Wow.
and I was like, okay, do I need to remove the tree is too close to the house, you know, the roots are actually damaging the concrete here.
Mm-hmm.
It also offers a lot of shade, but I have never used them. And the tree is now 21 years old.
Yep.
It's way over the roof. It's very, very tall now. But it started out as a 6-inch, little thing.
Yep.
But yeah, black walnut, and it took until 3 years ago before I actually knew what kind of tree it was, because it was planted by the previous owner. But that's a good thing, that black walnut. So you could actually take black walnut oil and then use that. Now, the reason that I put these my own pictures up was this was such a good example of that lymphatic rosary. And I already mentioned that you find out from the iris weaknesses that you're not even aware of, and that was the case when somebody told me 5 years ago that about the lungs. I was like, I don't have any problems with my lungs. And not realizing, what iridology reading really could do for you, and that it can't show the weaknesses. So yeah, it is also so interesting.
Now I
And
see you have a little deposit spot down by your bladder. It's a little
yeah,
dark spot there. Now that's either chemical, it could be something in there that I don't think is anything that's chronic. I think it's a deposit of some kind, whether it's chemical or whatever it is.
yeah,
But
I had this since teenage years, so it's quite some time ago. And from say about 6 months old until throughout my childhood and teenage years, I had a lot of antibiotics.
uh-huh. Yep.
And I had what is it? Well, I actually had it before I had the ectopic pregnancy when I was 29.
Mm-hmm.
Oftentimes you can see part of that too, but yeah, there is definitely some improvements between the 2 years.
Oh,
So
yes.
so yeah, this was pretty good. It's I hope that people had some benefit from it. And if you want to do an iridology reading, let us know. And you can get it all in written form. At least I do it in written form. And again, if you want to have this one as a PDF, and I can still add the sclera chart, because that would be interesting for most people.
Mm-hmm.
Um, I see very, very few red lines here. Mine.
Right. but wherever they're pointed at a specific spot in the iris.
Yeah. Yeah, it's just a beautiful thing to work with this. Now when I see people and I look at them, even models, and it's like, oh my gosh, girl.
Yeah, I know. I know that is and you have to learn not to give advice where
Oh no, you can't say anything. It's like,
uh,
okay.
and I used to find myself staring into people's eyes, trying to read their eyes while I was standing there, and no, that's not a good idea either.
Yeah, I'll do the stop share, and I want to see if we had any more questions, if I can find that one.
While
Uh,
you're looking for questions, Tony, I was gonna say, I I had an aha moment when we were looking at your eyes, Tony, and Gary was talking about it because he said, you're not absorbing, or no, Gary, I think you said you have to go to the bathroom more frequently, and that could be a sign of you're not absorbing it. And I know so many women, especially women who've had babies, that they pee all the time. And now I can be like, well, it could be you're not absorbing anything. So that was an aha moment for me.
And it could be because everything that you were seeing in there is electrical. Okay, if the electrical part of the body is weak, that affects your parathyroid and your thyroid and all these different areas, right? So as we build our electrical system up through our breath and the proper hydration, nutrition, and oxygen and all that stuff, uh, then it will get stronger. But remember, all the body is a bunch of tubes, like thousands of miles of tubes, sphincters, which there is one for the bladder. And a lot of times when people get pregnant, that sphincter gets weak. So there's not enough electrical charges, not enough energy for it to stay tight. So they have to pee all the time. Or bladder infection is another one that happens that makes you feel like you have to go to the bathroom all the time. Uh, and you really don't go that much when you go, but it's because things are weak in that area. So getting the body strong again will help make that sphincter strong. People that have incontinence, that's what it is. The sphincters are weak. So they can't hold the way they used to when they were young because they haven't been taking care of that area. So,
What about women who like they go to the bathroom and then they're done going to the bathroom and then they feel like they didn't empty their bladder?
right,
Okay.
right. So that would be more of, I think, an infection, a bladder infection.
Okay, thank you.
Okay, we have Donna had questions. How do we help heal our thyroid and parathyroid? Um, we have some options with herbs that you can use, even glandulars, Donna. So we can go over that. Ethan asked, have you and Gary both seen instances where some actually has blue eyes, but is born with dark brown looking eyes? If so, how common is that? I have not seen the difference. Maybe you have, Gary. And he goes on, my eyes look mostly a yellow with orange shade, with orange mostly around pupil and green in nerve rings, with dark brown rings around pupil, but I was born with very dark brown eyes. Are they 100% actually blue, since I see quite a lot of green in the nerve rings in direct sunlight?
I would say that they could be blue because you can be born with a lymphatic issue so strong that your eyes would be, they're not really brown. They're kind of a dirty looking brown. And the orange is sulfur. So it'd be a good idea to get that out of the body, the sulfur. And that can come through food, it can come through medication. Uh, but if there's any yellow in the eye, then it's blue behind it. any green in the eye. There's blue behind it because that's the second stage of lymphatic congestion. That second stage is yellow, and over a blue eye, it would look green. It can look yellow. And the brown part is chronic congestion, chronic condition, wherever that is in the iris of the eye. So he may find out as time passes, if he keeps cleansing his body, his eyes may turn blue.
Yeah, it will take a while. It's not something that happens in a few months
No.
or maybe
No, it
even
doesn't.
a few years. It goes over time.
Right.
I would like to go into a few things that Kathleen mentioned. I almost died at 10 years old having my appendix out, and they hosed me up with all of the infection still in me. I've also had 2 C-sections and a laparoscopy. Yeah.
Yeah, laparoscopic. Yeah.
Yeah, that's it. I never used that word, so I've never even pronounced it. I just started sweating this summer. Obviously, with all my neurological issues, I can't sweat or lose all motor function. Soon as I overheat, I can't move. That's my catch-22. I live in a cold climate and no longer have access to the sun to cause my sweating. And I think we lost Gary.
No, I'm listening. I'm thinking. The motor's turning here.
Yeah, okay.
So that's interesting. That I mean, a lot of people can't be in the heat. Now they may try what you did with the sauna. I think it's you said your head was outside,
Yeah, yeah.
and they might try that. There's not many things that you can do that. I mean, you got to get that lymph moving. And maybe just go outside in the sun and go for a walk. But yeah, neurological, I mean, breath is huge for that. I mean, it's what turned on your electrical system. So as it turns on the electrical system, all those issues will they'll weaken. Right now, they're stronger than your electrical system. But as you learn to breathe and move and hydrate with good, energizing foods and liquids, and get that oxygen in that blood so it can travel through, all those things will go away. I mean, it's incredible. I mean, I worked with one person, they gave her 14 days to live. She had a paralyzed face, 70 listed diseases, and 14 days to live. Here's your paperwork. Go home and get your paperwork ready because you're out of here. So she found me on the internet, and 10 months later, no paralysis. Her skin was all nice and clean and clear. It's been, I don't know, 4 years now, maybe 5. And she could be a model. And that was from 14 days to live. You know, I mentioned in a video the other day, when I was a kid, I'm 74. When I was a kid, they took a cell from a sheep and put it in a test tube and made a environment inside that test tube and grew a sheep from it. And they're telling us that they don't know how to fix a cell. Come on. I mean, it's insane. The things that we are expected to believe about our bodies, and how, you know, if you go to a guy with drugs and a knife, you're going to end up getting drugs, and there's a good chance you're going to end up getting sliced with the knife. And, you know, their motto is, I'd rather cut it out than clean it out. And then they just get you on the treadmill where you can never leave that system. So you become a lifetime customer.
Let's be careful, Gary.
Yeah.
What we say.
So I know.
That is all our opinion. It's only our opinion. There were, Ethan just mentioned, will rebounding on a trampoline help me move lymph greatly and heal much faster? to see my true eye color. You got to be patient, Ethan. It's just
Yes, but it will help. It will
yeah,
help.
but you have to be careful when you do it, when you're just starting out and your kidneys are not filtering, because then you create more problems than you want at that time, because I did it. And I had to hold off for a little. He mentioned, should I mostly do the health bounce with feet on trampoline or bounce in the air? I would actually just bounce with feet on trampoline. You can even do
Right,
that the grass, and you don't need to get off the ground. It's just a little bouncing. You don't even need a
right.
trampoline for that. So
And
it's but be careful if you are just starting out or if your kidneys are not filtering yet. And well, let me see. Oh yeah, Kathleen asked, being born with brown eyes, does that mean my mother was really lymphatic stagnant? And that reminds me of my mother having really green eyes, very green eyes. Now, she's a redhead, I'm a redhead, and I never wanted to have green eyes. I don't know why. I didn't like it. But yeah, that could be the stagnation, you take over from your parents. Same lymphatic system that you shared with your mother in blood. So yes, and it can all change. Now we have to still go into something from Donna, because Donna was on a few weeks ago, and we talked about hives and how bad it was. So she is like, "Well, how about hives?" And it was the first time that I actually heard, Gary, about the black walnut for hives. Now, how would you do that? Would you, if you don't have them fresh, like, my whole yard is covered with it, and but you said scrape off the hull. These things, the black, I have never seen a black walnut, Before I came here, I had never even heard of it, and later on only heard how expensive the wood is from a black walnut.
Mhm.
But these things are very hard. If I try to open them, there is like a tiny little bit of what you would, almost consider as an edible walnut, but it looked like it shrunk. It's kind of odd. And you said use the hull. The hull, that is the hard part on the outside, because it seems it has two things on the outside.
So I don't know. I'd have to investigate that. I've never actually done it. I just know that it works.
Okay.
And if you take black walnut hull inside, it will kill parasites if you take it internally.
Right.
But
Yes, that is what I found out about that. Donna also asked, I'm interested in a process to detox my liver. Through muscle testing, it showed my liver needs some help. I started on black cumin seeds. Well, I feel that it's still doing treatment. And I'm all for all the things that we talk about all the time here. It is, be hydrated, get your kidneys to filter, your lymph moving, and then your body can start healing. We do have a good liver skin, and that would be actually amazing for you. The liver skin formula. Now I don't know exactly what is all in there. I have a whole bunch sitting here, but not sure where I have the liver and the skin part. But I would use that, and yeah, don't use it just as you're gonna heal only one thing. Your body decides actually what it will heal first.
right,
It's not really it's not really up to you.
that's right. And to remember
I don't
that.
want to be mean. I almost sounds mean.
Well, the body is like a million times smarter than we are. And
Yeah.
we've been, you know, and I go back to the old thing that I always say is healing is a feeling. And we've lost the ability to feel our body. And it's like a baby. Every cell is like a baby. The only way it can get attention is to cry. Well, the only way a cell can get attention is to put you in pain. And it's a wake-up call. So that we can figure out what we need to do to help it. And we don't need to, but all we need is proper hydration, nutrition, oxygen, movement, rest, grounding to the earth, and to have a great story of, I may be sick right now, but I'm getting better every day. You know, my mind gets clearer, my body gets stronger, my digestive system is in balance, my heart is starting to open, and my mind and my heart are sharing all the time in a good way. You know, part of this Ozempic thing, I don't want to get into that too deep, but it's, see, your heart, your stomach is in constant communication with your brain, and it's sending what it needs, and the brain produces it and sends it down there. Well, if you're taking things that are altering your ability to digest food, it's not going to send the right signals to the brain, and the brain's going to be making inferior things to send to the stomach. So you're out of balance when you do that. When we sit, how do I want to phrase that? If we follow those who interrupt our ability to process our food and distribute it through methylation, right? Because everything we eat, even fruit, it goes in as a raw material, and methylation takes out what it needs to feed the body, and it gets rid of everything else. So in that methylation process, if your digestive system off, your methylation is off, and it's not able to pull out what the body needs to help it regenerate itself. And all malabsorption is a cell sitting in acid, and it keeps building layers and layers and layers of mucus around it, and it makes it harder for the nutrients to get into the cells. So as we're doing the breath and we're doing the movement and we're hydrating with good liquids and alkalizing, it will start to open up the lymphatic pathways, and that acid will leave, and that cell can regenerate itself back to a healthier, and another healthier cell. Because right now it's regenerating itself in a weakness. It's a weak cell. But as it gets clear and it starts to absorb and get everything it needs, it starts to get stronger, and it will regenerate a stronger cell. That's the difference between disease and health. So it's important to remember that. You know, we're feeding the cells when we eat, and we're either corrupting them by giving them more acidic things, or we're alkalizing them, helping them become stronger by the foods we eat. I mean, it's pretty simple. So that's why when I do an eye reading, I just hit a few things, because you can't work with just the liver, because the liver affects everything in the body. You can't work with just the kidneys, because the kidneys affect everything in the body. Same with the adrenals, same with the lungs. Okay, they come out as the weakest spot. Let's say it's your lungs, and you have and they're weak. Well, we have movements we can do in Qigong that will completely clear your lungs. It's not going to happen in 10 minutes, but it can happen in 30 days. It can happen in 60, 90 days, but you have to be dedicated to it. And it's very simple. You know, for people with lung issues, first off, you'd want an herb like mullein. I'm sure Dr. Morse has a lung formula. And you just, when you inhale, you pretend there's a ball on your chest and you roll your head back. And you pretend there's a string on top of your head, and it goes up towards the sky. Okay. And then when you exhale, you go out, and you just repeat that, and it will clear your lungs. Why? Because C3, 4, and 5, which keeps you alive, is the nerves that go from both sides. Because your diaphragm can be paralyzed on one side and still function on the other, because the body's split in the middle this way. So as we're working C3, 4, and 5, we're working with the diaphragm, which is helping to clear the lungs. I mean, it's so simple that a lot of people don't believe it. You might hear, well, if that was true, my doctor would have told me. No, because the doctor doesn't know. That's not what they. Go ahead.
Gary, we are already at an hour and 45 minutes.
Wow.
Time flies. Ethan managed to get 2 more questions in.
All right.
Oh, it was actually, he said he had 2 more questions, but he only wrote down 1. He said, thank you so much, Toni and Gary, for your advice. I only have 2 more questions. Is seeded watermelon or seedless better for moving lymph? Anything seeded is always better.
Yes.
Does it particularly make a difference in moving the lymph? No, I don't think so.
No, the only thing anything that is seedless will make you seedless. Because everything is born through seed.
Yeah,
So,
but we get to a point, Gary, that like I have not seen seeded grapes in years.
mm,
And now, actually, they start here. I saw that a while ago that they were seedless lemons.
yes.
Lemons always have a lot of seeds, but I actually saw seedless lemons, and I like, oh, they don't give up.
Yeah, and the thing
Yeah,
about seedless lemons is the tree only lives about half the life of a seeded tree.
right. Oh, here is a second question. To make sure my kidneys are filtering correctly, should I leave urine out 24 hours or so to begin to see cloudiness in urine? I usually see hundreds of specks immediately in it if I shine a light on it. You leave it sitting up to 6 hours. I mean, if you leave it any longer out, it starts to ferment. And oftentimes people think, oh, it's the same as with what is it, the apple cider vinegar with the mother, and you see the fermentation on the bottom. Well, that happens with urine too. So I would just leave it out up till about 6 hours, and then you can shake it. But it's a good thing if you see it right away. And important is if you see that cloudiness or sediment, if you are on the correct diet. So Matt now says Costco sells those huge black seedless grapes and they freak me out, so I never buy them. For me, I buy actually only the organic black grapes, seedless black grapes, and I usually get them at Sprouts. And you have Sprouts all over. They are reasonably priced, and it's what we have to do it. I mean, I have been lucky this year in getting seeded watermelons, not organic, seeded, and they were absolutely delicious. I found that
Mhm.
seedless ones have barely any taste, so I don't do that anymore. But yeah, and I understand what you say, Gary, with about the seedless part, but we do the best that we can.
Oh,
And
absolutely. No, I'm just saying, if we eat seedless, we become seedless. It
right,
won't be in our generation, but generations down the road.
right.
Um, which is why they're doing it. They're taking the seeds out of everything because nothing can be recreated without a seed. So, uh, well, there are other things, but we won't get into that today because we'd like to leave the video up. So, yeah, we just do the best we can. It's like water, okay? Uh, when we drink water, or what's the best type of water? Water is the best type of water. And most everything that's made commercially will dehydrate you. even though you feel like you're being hydrated. But in the long run, it dehydrates you. Coffee, I think it's 2 or 3 glasses of water you have to have with every cup of coffee you drink, just to overcome the dehydration that's from a cup of coffee. And think how much coffee is people drink.
Yeah, true. And you can see the dehydration in people too.
Yeah.
And you still cannot say anything, only like, well, coffee is not that healthy. Okay, we got it. We got to end this because I know you and I, we can keep going. Always something comes up that we can talk about, but we have to look
Yes.
a little bit for other podcasts like next week. And have no idea what we're going to talk about, but I'm sure we can come up with something.
Oh, yeah.
And the week after, I think it is the week after. Yeah, it is, isn't it? The week after it is Thanksgiving.
Okay.
So Thanksgiving, I decided to not do a podcast.
Okay.
So anyone, a lot of people are with family, and so we can do a week without. So I want to thank everyone for being here. Unfortunately, Katie and Sarah already had to leave, but I was very happy for them to be here. They always have to add a lot of good stuff to
Oh,
it,
yeah.
and Gary, I I love you so much with all the information that you always come up with and the patience that you have and how you are helping everybody. So thank you for being here, and much love to everybody who has been watching and listening. If you need any of Dr. Morse's herb, there is a link in the description where you can go to, and if you want to have a discount, you just put in the discount area my name, Toni Weel, all as one word, and you get at least 5% discount. They may have other discounts too. You just have to see that. It has my email in there, so you can always get a hold of me or send me a message. For everyone who is listening here, do me a favor. If you like what you heard, click on like, click on subscribe. That will help to get our information, actually get it out to more people. That's just how YouTube works. As for, I mentioned that in the beginning, that last week podcast was deleted by YouTube because of mentioning vaccines. And I have it uploaded elsewhere, but to get that link, I have been putting it in on Facebook and I think a few other places, Telegram too, where I posted. If you want to listen to that one, then send me an email and I'll send you the link. I don't know how else. I cannot put it in what is it, in the description here on YouTube. So we'll just do it that way. But eventually I will put all the videos that we have here on YouTube. I put it on another system. It's personal system, but not any of the social media things. But it is very time consuming, so it takes time. So again, thanks all for being here, and till the next time. Bye bye.
See you later. Love you. Bye.